Hi everybody, this is a video about whether there are side effects or issues with taking the chelating agent EDTA long term. Just before jumping into the video, if you don't mind taking a quick second to please either like, share, and or subscribe and or post a quick comment on this video, I'd really appreciate it. So thanks in advance for taking a second to do that. And as per usual, nothing that I'm saying should be construed as medical advice. This is for informational purposes only. And if you need medical advice, please talk to your healthcare provider to get that advice. So the question today is, I've been finding EDTA very effective for biofilms, but someone told me not to take a long term because it can deplete other medicines / supplements. Have you heard of this? So thank you for the question. So with EDTA, the one thing to be aware of is that it is a chelating agent. It's a heavy metal binding agent, and it strongly prefers to bind heavy metals over virtually anything else. Its top preference, to my understanding, is lead. Second preference is mercury, and then it has an affinity for a bunch of other heavy metals as well, like aluminum and cadmium and nickel and various other heavy metals. The thing with chelators is that while they have a preference for what they want to bind to, they will bind to other things if those preferred things are not available. Just like a person might say, I really prefer to eat lasagna and pizza all day, but if all that I can get is, stale bread, I guess I'll just eat the bread. So there's preferences for the chelators, but they will bind other things if there's no other options available. They will bind minerals as well. So they'll bind calcium and magnesium and other minerals. So we do have to be mindful when we're working with chelators, because if a person is taking chelators and they don't have heavy metals to bind to, then they will start to bind healthy minerals, and that's not good, obviously. That's why, at least in many parts in Canada, maybe all parts in Canada, for us naturopathic doctors like myself, we have these kind of rule sets where, before we start doing, say, full-blown chelation therapy to, haul out heavy metals from a person's body, we need to test first to make sure the metals are actually there. If there's, if a patient comes in saying, I was exposed to mercury, I was exposed to lead, or I have all the symptoms of mercury or lead accumulation in my body, we can't just presumptively go in and start treating. We need to actually do some testing first, just to make sure that we're not treating inappropriately. Now, where the conversation gets a little more nuanced is around, why is a person taking EDTA? And EDTA is question indicate, or the question / information here indicated, is that it can also be used for biofilms. Why? Well, biofilms, to my understanding, when they become really entrenched in a person's tissues or on a person's tissues, then they start actually accumulating heavy metals that are just floating around in the bloodstream. Unfortunately, we all have heavy metals in our bodies, largely due to just choices that our forebears have made about pollution and things like that. So we all have lead and mercury and things like that in our bodies, hopefully in very small amounts. But those metals will start to get incorporated into the biofilms and make the biofilms a lot more rugged. I kind of think about biofilms as almost, I think about more evolved, heavy metal containing biofilms as having like literal metal scaffolding in them to kind of really bolster the structural integrity of those biofilms. So it's still a question around, or it's still a situation where the chelators are binding up metals. It's just in biofilms, not just floating around in the bloodstream or tucked away in a kidney cell or a fat cell or something like that from environmental exposure. So the challenge there is that there is no test, there is no lab test, to my understanding, that can tell us about the biofilm content in a person's body. Yes, there are some sinus swab tests that can be done to assess for biofilm sort of synthesis happening in a person's sinuses, but in terms of saying, how much biofilm's in my blood vessels, in my joints, in my brain, like wherever the biofilm might happen to form due to systemic microbial issues or mold issues or things like that, we don't have a test to enumerate that. So in that case, if we're using something like an EDTA nasal spray, or maybe intravenous EDTA, or maybe EDTA capsules, if we're trying to treat intestinal biofilms, there's really not that metric that we can get ahead of time, like for going after heavy metal accumulation, of where we would do, say, a provoked urine test to see, does a person actually have elevated heavy metals in the first place? We don't have the luxury of that type of objective test for the biofilms. So what are we to do? Well, we just have to use our best judgment as clinicians, and patients listening or not listening to their clinicians, about how we're going to manage that. So if I had a patient where that we were working with a chelating agent, going after biofilms, and we were kind of tracking things based on clinical results, like, oh, my patient's taking a biofilm disruptor, they're feeling better from that. It's been a few months, they're still not 100% better, they're getting progressively better every few weeks or so, but so we want to keep them on the biofilm disruptor, but man, they've been on it for a few months now. It might be a good idea for, in that case, it might be a good idea, and what I would usually recommend or consider for my patients in similar situations, to start working with a mineral replenishment protocol, just to make sure that they're getting enough of those extra minerals. So if the chelator is starting to steal away a little bit of calcium, a little bit of magnesium, a little bit of zinc, if we have a multi-mineral in the mix, then that's going to help to bolster what's hopefully a pre-existing healthy diet with enough of those minerals to replenish those stores. If a patient started manifesting frank symptoms of mineral deficiency, so they start, developing like, I'm losing my sense of taste and smell. Well, maybe that's a zinc deficiency, or I'm getting muscle cramps, or I'm getting anxious or insomnia now. Maybe that's a magnesium deficiency. Those would be clues that we would definitely want to get on top of those manifesting mineral deficiencies. I've really never seen that happen with chelation therapy, whether it's for biofilms or for removing heavy metals. It's something I haven't seen in practice. I think it's probably something that's quite rare, because I've recommended chelation therapy and or biofilm therapy for thousands of patients now. It's not something I think is likely an issue, but it is something to watch out for. And then, just again, for good measure, if we're using those chelators for a prolonged period of time, more than a few months, it's not a bad idea to make sure that we're getting some mineral supplementation in there, just for good measure. If one of my patients was using an EDTA-based nasal spray to go after, say, sinus biofilms, that would be a situation where I really wouldn't be concerned about systemic absorption, because the amount of EDTA that's being administered is just very, very small compared to what we'd be using, say, intravenously or in maybe oral biofilm disrupting capsules. On that note, EDTA itself, when it's taken orally, it has very, very poor intestinal absorption. So unless a person was taking a biofilm disruptor with EDTA alongside their food that was full of minerals, which would generally not be the recommendation, because we don't want the biofilm disruptor to bind up the minerals in the food, so usually they're taken away from food. There really isn't going to be a systemic absorption. So quite frankly, when I'm using oral biofilm disruptors, I don't use ones with EDTA. It's with either DMSA or DMPS, which are different heavy metal binders. But if a person was going to take an oral EDTA to, say, go after systemic biofilms, well, A, it probably wouldn't really work, and B, we wouldn't really have to worry about the mineral binding up issue unless it was being taken alongside food, because it's just not going to be well absorbed in the first place. So anyways, that's starting to get into the weeds a little bit there. So I think I've covered the gist of the question that was asked. So I hope that answers your question. Thank you for the question. If anybody has any comments or questions on this topic, please post in the comment section below. Or if you have a question about a different topic, please feel to post that in the comment section below, and I'll do my best to answer as soon as I can.